Well, morning. I'm out and about again. It's a very early morning. I'm very excited and I'm very nervous because it's the day of my breast operation. So I'm having breast augmentation. I made a previous video about that, which explains all about that. But basically, I've been on hormone therapy now for 3 years, 9 months, and I've had some breast growth, but not quite as much as I'd like to keep my breasts in proportion to my torso. So I decided to have implants. About 60% of trans women do that. So I'm just one of them. So anyway, today is the day. So I'm just outside the hospital now. It's very early morning and I'm just about to go in. So see you on the other side. Well, I'm back and the deed is done. Can't tell a lie, it's been a tough day. Been lots of nausea and it's a fair bit of pain, but the painkillers have kicked in and so it's eased it a bit. It's been tough, but I'm feeling much better now. So I'm on the mend, I am okay, and it's onwards and upwards really, so and outwards. But there was all the staff here, all the doctors and nurses and the surgeon, they've all been absolutely lovely and they've been so kind and really helped me. But there was an incident where I overheard two of the nurses misgendering me. They were using he and him pronouns about me, because my room is within earshot of the nurses' station, and I heard that. Now, I don't blame them for that. They didn't mean to insult me or anything. But it's just a lack of education, and I don't blame them for their lack of education. I do blame the hospital management for their lack of education on the subject, though, particularly if they're a hospital supplying services to trans people. But anyway, I managed to have the chance to have a chat to one of the nurses who did it, and she was lovely, and we had a great chat. But I consequently ended up doing part of my trans awareness training session to her 7 hours after my operation in my hospital bed. That was something I wasn't expecting to do, but it helped. It helped her get a better understanding. I shouldn't have to have done that, but it's how it is. I just couldn't help myself. You know what I'm like. Anyway, I'm going to sign off for now, and I'll give you a bit of an update next. Take care. Bye. Well, it's now been a whole week after my op. I'm feeling so much better now. I'm in far less pain than I was, and it was tough for the first few days. But I'm still very sore, but that's to be expected. But I've been able to reduce the painkillers now, so that's really good. And the dressings have been taken off now as well, so that's all progressing really well. And it's funny, when I look at my boobs, they're absolutely massive at the moment, just because there's still a lot of swelling. And they're sitting quite high up at the moment, but it takes about 6 weeks to actually drop down into their final position, and about 6 months actually to settle completely. So it'll be certainly 6 weeks before I can really assess the outcome. Certainly looking at the moment, that I'm very pleased with them, and hopefully they'll reduce down to the size that I'm happy with. They don't look massive to anybody else at the moment because they're just being held in place by the sports bra, which I have to wear for the next 6 weeks as well. I also have to sleep at a sort of 30 to 45 degree incline as well, which is a bit weird, but I'm getting used to it. It's all right. I can cope with that. That's fine. Another win actually is that I complained to the hospital about the misgendering issue, not at all to complain about the nurses, at all, but it's just the fact that their lack of education on trans issues. And the hospital responded really well actually, and they've actually invited me to come in and deliver some trans awareness training for them, which is great, because they said they did do some about 6 years ago, but they haven't done any since, and they've had a lot of new staff since, and of course none of them have been trained in it. So it's great. So they responded really well. Another thing that's happened is that just 6 days after my operation, I delivered a virtual trans awareness training session for an organisation. I wasn't planning to do any work for the first 2 weeks after my op, but because it was unexpectedly delayed, it then went into my recovery period. Actually, went into a phase where there was some work that was already booked in, and I didn't want to let those clients down. So I did those sessions, and it was a bit much really, so soon after my op. But I've been told, I've got to keep my blood pressure down. Unfortunately, I mean, the session went really well, and the organisation was really supportive. But unfortunately, there was one member of staff there who was very anti-trans, and she secretly filmed my session and then put lots of snippets out on Twitter, quoting me completely out of context. And of course, then that incited a load of other anti-trans, hate tweets basically, and I've just been absolutely bombarded with them. So there's been a real Twitter storm, but hey ho, it's free publicity. I should thank her really, shouldn't I? But there you go, yeah. So this is me trying to keep my stress levels down and the blood pressure down. And I certainly didn't think that I was going to be fighting off a Twitter storm in the first week after having major surgery. But there you go. That's what happens when you stick your head above the parapet. But anyway, I am okay, and I'm feeling so much better, and I'm so glad I've had this operation. So I'll see you on the next vlog.